everyone, today I will be presenting my policy analysis of the HEARTH Act of 2009. So the Homeless Emergency Assistance and Rapid Transition to Housing Act was created to address chronic homelessness by providing a focus on prevention, rapid rehousing, and the housing first model. So homelessness affected more than 670,000 people in 2008, and the issue was more specifically severe for marginalized community, highlighting deep racial and economic inequity. And so the earlier McKinney-Vento Act of 1987 mainly funded emergency shelters but failed to provide long-term housing solutions. And as a result, homelessness continued to grow due to rising unemployment rates, limited access to healthcare, and lack of affordable housing. So by the late 2000s, the United States was facing an economic recession and a housing market collapse, and these conditions pushed more families into homelessness, forcing the federal government to rethink its current McKinney-Vento Act. Thus, it led to the development of the HEARTH Act. It was first introduced in 2009 as House Bill of 1977. It received strong support from both parties, and eventually it was passed as part of the Helping Families Save Their Homes Act signed by President Barack Obama. And by 2010, Congress allocated over $2 billion for homelessness programs. And so the HEARTH Act aimed to shift from short-term shelters to long-term housing stability, and its main objectives were to prevent homelessness, improve coordination among agencies, and collect reliable data through the Homeless Management Information System, also known as HMIS. So overall, the HEARTH Act strongly reflects the National Association of Social Work's Code of Ethics, really highlighting the values of service, social justice, and human dignity. More importantly, the Housing First model recognized homelessness as a systematic issue, not as a personal failing. Thus, it really treats housing as a basic human right. So between 2010 and 2015, the HEARTH Act led a 21% overall reduction in homelessness and nearly 47% drop amongst veterans. And these results were linked to rapid rehousing and supportive services. However, the progress was uneven. Rural areas struggled with funding access, racial inequities still persisted. And this shows that while the policy worked in many areas, it didn't reach everyone equally. And so the Act's emphasis on data collection through HMIS improved accountability and made it easier to track the outcomes. However, it also created challenges because communities with fewer resources couldn't always meet that reporting requirement, leaving marginalized populations at risk. So overall, the HEARTH Act was a huge step towards addressing homelessness through a more humane and evidence-based approach. However, it remained partially effective because it didn't tackle the full structural and racial inequities driving homelessness. So from a true social justice perspective, true progress requires centering equity and ensuring that all population benefit from housing programs. So to maximize the HEARTH Act potential, future research should include more intersectional research, expanding on education, rapid rehousing to ensure that the effectiveness stays consistent. And policy revision should also be expanded on racial equity measures and simplify federal reporting. And lastly, as social workers, we can integrate trauma-informed practices that include community input. So overall, these steps would make the HEARTH Act more equitable and effective in achieving its mission.